Welcome, this is Dr. McNeil, optometrist at Crown Point Optometry, and today I'm going to be talking about eye emergencies. Especially in this day of social distancing, people may want to know in terms of eye emergencies, like what is an emergency, what isn't, a little bit about what symptoms to look out for and what are red flags in terms of your eyes. So I'm going to be talking about a few of them. First, I'm going to be talking about are pupil changes. So if you notice a change in the size of your pupils, especially if it's one pupil compared to the other, that's definitely a red flag and should be addressed right away as an emergency, just because there's a lot of dangerous things like aneurysms and things like that can cause that. So that's definitely something that is an emergency and can't wait. So we're going to talk about the irritated eye. So depending on the level of irritation and how long it's been going on for, that's something that is usually safe to take a wait and see approach, as long as your vision isn't, as long as you haven't lost vision from it, and as long as you're able to tolerate it with over-the-counter measures like artificial tears. This is generally something that can wait a few days to see how it goes, because sometimes those can be things that are self-limiting, like a minor scratch eye when you rubbed your eye, an eyelash that was scraping the eye that will eventually fall out, those minor self-limiting infections, those kinds of things. But again, it's certainly if vision is impacted, that would be a time to get seen. So now that kind of goes into red eyes. So a red eye that's new or unusual for you, especially if it persists more than a day or two, is something to get looked at, unless there's a normal explanation for it, and this is something that happens to you periodically. It can be anything from side effects to medications. It can be infections, inflammations. It can be any number of things. So again, if it's a new thing for you, then that should be looked after. So in terms of accidents to the eyes, generally speaking, if the vision isn't impacted and there's not a lot of blood in the eye, there's not like a black eye, then it's something that can wait. But if you have any of those types of symptoms, any changes to vision, any changes to pupils from it, any changes to ability of the eyes to move from it, any vision problems, then that's definitely something that you should get seen right away. We're going to talk about eyelid droops. So eyelid droops, especially that are both eyelids at the same time, are generally not something to be concerned about, especially if it's not sudden, and it's kind of a gradual thing that's been happening for a while. But an eyelid that droops suddenly, especially if it's just one eyelid, that is something that should be looked at on an emergency basis and shouldn't wait. The next thing I'm going to talk about is flashes and floaters. So flashes and floaters oftentimes can be benign and are not something, but sometimes it can be retinal detachments or other things that are to be concerned about. So flashes and floaters are to be taken seriously and need to be seen in person by an optometrist or ophthalmologist as soon as possible, like within 24 hours, ideally within 2 or 3 hours of it starting. Sudden vision loss, like I've alluded to before, is also an emergency. Even if the vision loss comes and goes, it can be a sign of things like strokes. So any sudden vision loss needs to be seen, probably in an emergency room, if you're not able to get into the optometrist right away. So those are just some things that are true eye emergencies that will need to be seen even in this era of physical distancing. So hopefully that will help people out and to let people know kind of what kinds of eye emergencies tend to occur and what to do about them. Thank you, and if you like the content, go ahead and comment and like and subscribe, and enjoy the rest of your day.